All right, it does look like our numbers have evened out a little bit, so we'll get started with today's Summer Transition Series webinar. Good afternoon from Durham. Good morning and evening from where you're joining us today in the world. This is the pre-health advising webinar, and today we're going to hear from our Dean Pers on advising. My name is Carolyn Gilbert, and I actually work with our grad and professional students, so I'm just stepping in here to host MC a little bit of this webinar. Some housekeeping items before we begin. We ask that all the questions be asked in the Q&A portal of the Zoom function. Some of the responses or answers to your questions will be typed, but most of them will be answered live from our expert here on the call. And we have disabled the chat. That's just to keep our question answers organized. And we do want to say that this session is being recorded and it will be posted to our YouTube channel in a couple of days post-production. All right, and with this, I'm going to hand the microphone over to Dean Pers, and I'll stop sharing.
Good afternoon, everyone. Give me just a second to get some slides up, and then we'll get started. All right, how do those look, Carolyn?
They look great.
Okay, terrific. All right, well, I'm glad to be here this afternoon to talk about pre-health advising at Duke. My name is Alyssa Pers, and I'm the Director of Health Professions Advising. I lead an office that has 4 full-time pre-health advisors, and then is also supported by 3 academic deans in Trinity College who advise first and second year students. I am also an academic dean in Trinity College and lecturer in the Department of Biology, and have been doing pre-health advising for over 20 years now. If you would like to take a look at our website, the address is prehealth.duke.edu, and I'll be making some references to materials on that website as we go along. The next thing I want to tell you a little bit about is who we serve. So we are the Office of Health Professions Advising, which means that we're here to support a variety of clinical health professions, some of which are listed on this screen. So that can include those of you who plan to go into medicine, dentistry, veterinary medicine, physical therapy, become a physician assistant, a pharmacist, optometrist, nurse, genetic counselor, occupational therapist, as well as other clinical roles. We'll do a little bit of work with students who are interested in public health careers, but we'll probably refer you to other resources on campus. The bulk of our students are interested in attending medical school, but we're happy to support other kinds of health careers. I've put an asterisk next to dentistry, veterinary, and physical therapy because these are careers that are advised by professionals with those degrees who work with our office. All 3 of these career tracks also have their own pre-dentistry, veterinary medicine, physical therapy, student organizations, and the bulk of advising for those careers happens through those student organizations. And you can find out more about that advising on our website. So how do we work with students? We will not, beyond this webinar, work with first year students until you get to campus and are here and beginning the first week of classes. Until then, we encourage you to use our website, particularly the prepare section, and you'll see that on the menu at the top of prehealth.duke.edu. Website, and there's a number of resources that will help you. We think we got our files fixed, so I particularly want to draw your attention under that prepare section to a file called Tips for Choosing Your Fall Classes. That will walk you through placement and other considerations for many of the classes our pre-health students will take. The QR code on this screen, I encourage you to utilize. It will take you to a brief survey where you can sign up for our pre-health listserv. We will use that listserv to announce workshops that we're going to be starting the first week of classes. We will also do weekly drop-in hours so you can get advice, and those will be listed in the weekly newsletter. This past year, they've been on Zoom and occasionally in person, and we're probably going to do a combination of in-person and Zoom once school gets started. After you do the initial meet up with health professions advising, then you'll have the option to sign up for small group advising sessions that will start once the first 2 weeks of classes are over. So please sign up for our listserv. It's going to be the best way that we can push this information out to you and give you access to our advising resources once school starts. We'll have plenty of opportunities for you to meet with us in groups during your first year, including those drop-in sessions. And then we'll start individual one-on-one advising in your sophomore year. But there should be plenty of opportunities for you to get your questions answered through other opportunities. All right, so I just wanted to take a couple minutes today to talk about getting started as a pre-health student. The first thing I want you all to do is just think for a minute, what's the health profession that you want to go into? And what is the reason or reasons why you're interested in that field? This is a question that my office is going to challenge you to answer over the 4 years you're here. It's something that you should be contemplating and exploring and developing the best answer you can. Because when you apply to any of these health profession schools, it's going to be the $1 million question that they're really looking at. They're looking at, have you explored this career? Have you assured that it's the right thing for you? Does it fit with your values and interests? Is your sense of this career realistic, or does it sound like you've just been watching TV dramas about medicine? So the other thing I tell Duke students is y'all may think that getting into the professional school is the challenging thing, but y'all are bright, capable, highly accomplished. The challenge over the next 4 years is to convince yourself that the health profession you think you want to go into now is truly the best vocation for you over the long run. Most of these schools are going to take, a minimum of 2 to 4 years of education. If you're going into medicine and some of the other careers, there's added time for residency, and then a long time to practice. But you want to make sure that before you are able to open those doors of access, that it's the right path for you. The other thing I want you to stop and really lock into is, why did you pick Duke? What are the programs or opportunities that you found attractive? We know from admissions that things like the Lemur Center and basketball and Duke Engage and Bass Connections are things that students hear about and want to take advantage of while they're at Duke. I want you to lock those firmly in mind now, because what I don't want you to do is get here and lock into the career you want to get to on the other side and forget to stop and take advantage of these things. Almost all of these opportunities, as well as other things you'll find out about once you get here or as you learn about Duke, are going to be things that will enhance you as a person and therefore enhance your application. So don't miss these opportunities to do things that are really meaningful and valuable to you, because they will shape the answer to that question of why you want to go into that field, and also help you to stand out as not any pre-med from Duke, but your own unique pre-professional student that's an appealing candidate when schools are looking at your applications and interviews. All right, so the big things that my office is going to help you with on the front end of your time at Duke are the things that schools are going to require of you. There's a set of courses that each professional path is expecting that you complete before you matriculate. In some cases, they're evaluating how well you do in those courses as a sign of your readiness to be successful in that field. They also are looking for particular types of experiences, and some have even set out some pre-professional competencies that we want you to be aware of, because sometimes these things can drive how you reflect on what you've learned from an experience or a course, and then also help you to evaluate your readiness and the quality of those experiences that you're getting. And then, hopefully you're getting from me that we really want you to think about, how does career preparation fit into your goals and interests at Duke? These are not two separate things. They're things that we want to be interwoven. I've taken to telling my advisees that I can't tell you what it's going to be on the front end, but I can tell you that if you're curious and you're engaged in things you care about, something is going to change in you. And it's going to be a change for the better, because it's a way that you're learning about yourself. But you won't have those opportunities if you're not paying attention, either because you're not picking things that you care about, or asking questions to get the information you need to engage in interesting and exciting opportunities, or you're not taking the time to reflect on what did you get out of it. And when it comes time to apply, it's all about how do you reflect. Unlike the application that got you into Duke, you got to do a lot of writing about what you did and what you got out of it, not just make a list of the things that you did. And schools are going to respond to those reflections. So we'll help you do that. But we really want you from the beginning to be doing that reflection and thinking about things, because it can drive big decisions like, what are you going to major in? What opportunities are you going to do when you realize you just can't do it all? So we want to make sure that you're considering how these things are intertwined. And then the last thing is, we won't interact with you a lot more beyond this, because your goal between now and when classes start is to choose 4 classes for fall. So hopefully you've gotten in and you've answered your first year questions. You've started to look at, how do I pick classes at Duke? Common starting places for our pre-health students will be to take chemistry and or math, specifically a calculus course. And so I am already starting to see some questions about chemistry placement. So I'm going to stop sharing my screen and let Carolyn come back and moderate the questions that are as they're coming in.
Sure. Yeah, so we have some great ones about chemistry. So can you explain, what is the benefit of starting chemistry 110 versus taking chem 101 and then chem 210? Can you explain the differences between these two classes and what is recommended for us to take freshman year?
Yeah, thank you for that question. This question is really getting at placement in chemistry. So depending on your previous experience in chemistry and scores, you have options about where to start in chemistry. So Chemistry 101 is the place that if you have a year of chemistry in high school, and I'm not going to know it off the top of my head, but a particular math SAT score, Chem 101 will probably be the place you start. If you have a 4 on the advanced placement chemistry exam or something equivalent, you could go into Chemistry 110. We call this honors chemistry. And if you take Chemistry 110, you don't need to take the combination of Chem 101 and Chem 210. In most cases, you will just need to take Chemistry 110. So taking 110 means taking a little bit of a risk and using that placement into a higher level class than you would if you took 101. But the benefit is you don't need to take a second general chemistry with lab or Chem 210 on the other side of organic. So it frees up an elective. There are so many classes that schools require you to take coming in that anytime a student has an opportunity to free up an elective and take a class they would prefer, it's usually a good thing. I will say, if you do not have a 4 on the AP exam, do not put yourself in Chem 110, even if you think you have an equivalent experience. The reason for that is most, and now I'm going to talk about medical schools, but most medical schools will require a year of general or inorganic chemistry. They'll give you credit for that AP or score or whatever other equivalent is if you have it, and then count 110 as the other half. But if you don't have that score and take 110, you are almost certainly going to have to take Chem 210 on the other end. So just be careful about that choice. And I'm going to go on, even though it's not part of the question. If you have a 5 on the AP exam, you can go straight into organic chemistry, which is 201. And most medical schools will recognize our advice for students to do that and not give you a hard time for not having that first semester of inorganic chemistry. And then on the other end of things, if you have a math SAT score below the threshold recommended by chemistry, they recommend that you take Chem 99, which will focus on problem solving as well as chemistry if you don't have that math SAT score or you don't have a year of high school chemistry, then 99 is what's recommended to get you ready for Chem 101.
This is like a different language for me. All right. So another question about, okay, does Duke do placement exams?
Yeah, so I can't categorically say we do or we don't. What I can say is that in chemistry, classes like 101 and 99, they will help you to refine your placement by doing a diagnostic quiz. And I have heard some murmurs that they may move that to online this summer, so you could do it maybe even before you register. I'm going to direct y'all to the chemistry website and their information about placement for those sorts of details. And if you can't find anything about a placement exam, you might want to reach out to the Director of Undergraduate Studies, or DUS, in chemistry. He would be the one that's responsible for those kinds of decisions. Math does similar things between 105 and 111. And then I think they also do some things for placing into their multivariable classes. Some language departments will do placement. But my impression is these things we call placement exams are really more about refinement of placement based on previous experience and then test scores like AP or SAT2. A really good place to start with all placement questions is on the Academic Advising Center website in Trinity College. Under their section for first years, they have a lot of links to all the departments where placement matters. So before you sign up for any classes, especially if it's not clear from the registration site where you begin in these departments, go look at that website because it'll give you a sense of where it matters and how to figure out where to start.
So thank you for all the participants asking questions right now. Dean Pers, do you want me to continue with questions, or do you have more content on your slides that you would like to get through?
I'm pretty sure I am done with my slides.
Okay.
So here,
perfect.
I know there's always a million questions. And
yeah. Okay,
so.
I'm going to try to, all these undergrad classes are very different for me. Okay. So let's see, this person wants to know about Chem 99D. Is it wise to start off slow with pre-med requirements like Math 105 and 106, or more beginner level classes to help build a foundation?
Yeah, and this is a great question. What I can say is anywhere we have placement advice that's based on test scores or previous experience, that advice is based in data. So if you have a test score that's below the cutoff, we do not recommend that you place into the higher level class. You go into a course like Chem 99. Math 105 is sort of like the equivalent of Chem 99 for calculus when you're deciding whether to go into Calculus 1, which is 111, versus 105, 106, which sort of decelerates Calculus 1 by weaving in more pre-calculus. The lower Math SAT or ACT scores that are used in the cutoffs for Chem 99 and Math 105 are not indicative of your capabilities with math, but they're usually indicative of your previous experience with math, the number of problems you had to solve in your high school. So if your scores are lower, you probably just have less experience. And so those courses like Chem 99 and Math 105 are just going to help you build up that problem solving muscle so that you'll be successful. I don't usually have to tell pre-health students that grades are going to matter. that many of these things are going to be tested on exams like the MCAT. I'm not trying to drive anxiety, but what I am trying to say is build a solid foundation. In a department like chemistry, you are going to have to take chemistry, at least 4 chemistry classes to get all the way to biochemistry. So if starting in 99 seems like the right place for you, do it. Because you want to be successful in that first class to build a solid foundation to get all the way to biochemistry. Chemistry is also essential for topics in molecular biology and physiology. Calculus is going to be required for calculus-based physics at Duke. So these things tend to build, and if you get a low grade in an early class, you usually don't have the content you need, and it's harder to do well in future classes that depend on that content.
Thank you. We have a couple questions about calculus. So I'm going to try to kind of ask all 3 in one question. I don't know how I'll do. Okay, so the questions are, what are your suggestions with calculus placements? And then another one is, if we're unable to take, if we're unable to take calculus freshman year because of scheduling, is it acceptable to take it sophomore year? And then other one related, sorry, my questions are jumping around. Okay, for pre-health calculus 1 credit, do 105L and 106L together count, or is there another class that we must take?
Okay, so great questions. I'm going to back up and say,
okay,
if you are pre-med, you need at least 1 semester of calculus or calculus 1. So that can be fulfilled by advanced placement credit, Math 111, or the combination of Math 105 and 106. So all of those will work. To the question about taking calculus after your first year, that is certainly okay. Sometimes students have other things they prefer to take. They're in focus, or they want to get chemistry underway and not, try to manage calculus at the same time. And that's fine. The only risk of postponing calculus till later is that so much of being successful in calculus is depending on your memory of things like pre-calculus, trig functions, and things like that. So the longer you wait to take calculus, the harder it can become because of that previous math that you're moving away from. That being said, plenty of our students will wait until their second semester. They'll wait till summer following their first year, or even fall of the next year to do that if it makes sense for them. You may want to just talk to your calculus instructor or look at those placement guidelines and try to figure out what is it that's essential to be successful in calculus that I might want to brush up on and review if I'm going to put a gap in there. But I want to just sort of interject right now. There is always this sense among pre-health students that there is a track they have to be on, and it's a rapid race, and everybody's got to be doing it the same way. Hopefully what you're hearing from me is that everybody's going to have their own pathway through these classes, whether that's where you start, when you start, how you do it. I also want to throw out that 80% of our students are going to wind up taking a gap year between Duke and starting health professions school. So it is totally normal for a whole variety of reasons if you're not ready to apply at the end of your junior year. So that can be because you took extra classes, you didn't take calculus from the beginning. And I'm just going to sort of offer out there that we've got a variety of sample schedules under that prepare section where you can see all of these things in action. Folks who are coming in with advanced placement credits, folks who are starting in Chem 99 and Math 105, even a scenario where students don't start their pre-health requirements until their sophomore year. We can help you deal with all of it, and it's going to be the right thing and the normal thing for you. So we're happy to support that.
All right, fantastic. I'm going to segue away from classes just for a second. I'm going to continue that conversation with this question. Do you have any advice for volunteering and extracurricular activities during pre-freshman and pre-sophomore summers? Is it important to start early?
Yeah, so there are several buckets of experience that And again, I'm going to talk about medical schools, but these are also shared by several other professions. Several buckets of experience that schools are looking for, and depending on the career, they may emphasize some more than others. So the first thing I like to recommend is you go out and do some community service. And this can be in an area of your interest. So if you want to work with students in elementary schools, or folks who are working on literacy as adults, on and on, you name it, you can do it. The goals here are to go out and build relationships, learn about people whose lives may be different from yours, and really start to see them as human beings, not people to be pitied or thought of as different, but build those strong connections so that you see that we're all human beings. And because disease doesn't discriminate, everyone is going to be your patient in the future. And so being able to treat them with respect and dignity and empathy and understanding is a really important thing to start from the beginning. Fortunately, we have a very service-focused campus, so you can go to the student activities fair and join all kinds of students clubs that are out in the community. This summer, while you're looking at classes, look up service learning courses, because that'll get you out in the community and getting you doing it in the context of a class. And so it's a great way to get started. Schools are also looking for you to do some provider shadowing, and to volunteer or have other contacts with patients. These tend to be things, at least on our campus, we don't make available until you are a sophomore. And I can tell you the pandemic has created such a backlog of demand that, maybe even longer for that. So if you can do it in your home community, great. I will warn you, anything you do before you matriculate at Duke, they will not want to see on your application. So, you can put some feelers out, starting getting experience, but just know that you're going to need to do some more of it after you start. Another big area is research. So I encourage you to look at calls for things like Fast Connections. We have a application program for research experiences called Muser, where you can apply. That will open up as we get closer to school. But sometimes research is a little bit harder for our first year students to compete with other students just because you don't have the class background or the background in classes. But that is something else you can do. Schools also value teamwork and leadership. So if you have opportunities to work on teams to solve problems, or run for first year liaisons or things like that on exec teams, it's an opportunity for you to get started once you get to campus.
Fantastic. All right, we're going back to calculus. That's where the questions are. Okay, so we got a couple. If I AP into multivariable calculus, can I take that math 212 and another stat to fulfill my 1 year of math for all medical schools? I think I got that out.
Yeah, so this is someone who's looked up the requirements. So sometimes schools have no math requirements. Other times they want a year of math, and others still specify they want a semester of calculus and a semester of statistics. I'm also going to introduce the advice around AP credits, which I haven't explicitly said. Generally at Duke, we advise our students, if you've got AP credit for something and you feel comfortable going into a higher level class, do it. It will save those electives for you down the road. And, again, because that placement is based in data, we feel confident you can do it. With the calculus, I also want to advise you that most medical schools will take AP credits, but not all. So it's probably a good idea coming in that you all look up the requirements for, say, half a dozen medical schools, just to see the variation that's out there. Start with your state schools, then other schools that you're curious about. If you don't believe me that there's a lot of variation, go look up Duke and UNC. Duke has almost no requirements. UNC requires an extra biology, 3 social sciences, and 3 humanities classes that make quite a long list of requirements. So just being aware of those differences is important. Now, most of you who are not from the state of North Carolina will not have much of a shot at getting into UNC, but that's just sort of an example of how much these things can vary. While you're looking at matriculation requirements for these schools also look at, if they have a math requirement, what's their AP policy about it, because they also vary considerably. There's a very small number of schools that will not take AP credits in all cases. And so you would do well, if those are schools that are high on your list, to be aware of those things now. What I can say is that in the 20 years or so that I've been doing pre-health advising, these AP policies have come and gone. So UCLA used to not take any AP credits, but then I think they realized they were missing out on some really great students that weren't going to repeat all those courses. So again, look up requirements, but don't feel like you've got to look them all up. If you're not finding schools that are important to you that prohibit AP test credits, then go ahead and place into the higher level classes and just keep monitoring these things in the end. What I've seen when students have placed into a higher level class and need to take a class down the road, it's usually one school or one class at a school that they really, really care about. So it's worth the pain of taking that class later. But I would say that's still pretty rare, unless you do something like place into 110 and not have an AP credit, then your odds of needing to retake a class are going to be much higher if you don't have the AP credit backing you. So I guess to get back to multivariable, sorry, there's so many layers. Okay, so you have AP credit to get into multivariable calculus. My first bit of advice is make sure you need that class. We see a lot of students coming into Duke that took math every year of their life before that, so they assume they need another math class. In many, many cases, you won't need it. The situations where you will need to take that multivariable class are, one, if you want to major in something like economics or math or physics or something, chemistry, that's going to require that for a class down the road. Computer science, I just tell everybody, go look up the math requirements for computer science. They used to require calculus, but now more and more linear algebra or discrete math kinds of classes are what they're recommending, and I just haven't kept up with those. Anything in the math department will fulfill a semester of math, but you do also need to be paying attention if you're going the linear route. Are you applying to schools that won't take your AP credit and are going to want a calculus requirement? That could create some decision points for you down the road where you need to take another calculus class. So this is where we're kind of looking at math beyond pre-health. We advise all pre-medical students and students in many other health professions tracks to take a college level statistics class. Chances are high school statistics AP was plug and chug into formulas and not very realistic use of statistics. I like to tell students, unless you want to be a stats major, don't take statistics until you know what your major is. Some departments are really picky about the stats they take. And I've seen situations where students take the wrong stats early and then they're in this bind with meeting major requirements. I also think stats makes a whole lot more sense if you've read some research studies that use statistics. You'll go in with a much higher level of engagement, a much better sense of mission of why do I need to take this class besides it's on the pre-health list. You want to get those skills to be statistically literate. Even better, you want to be able to use statistics to conduct studies, and doing it early to quote unquote get it out of the way is probably the worst way to manage statistics. So again, don't take statistics unless that's a major that you need to explore early on.
Okay. This question, I'm not sure if you can answer it, but we'll go ahead and ask it. So under the pre-health track, would you recommend double majoring in global health and a biology-based major, such as biophysics?
Yeah, so this is such a complicated question. The number of classes you have to take as a pre-health student is about the size of a major. In some cases, it's bigger. So the idea of having another major and another major, we're up to 30 courses. And by the way, to graduate from Duke, you need 34 credits. So we're almost at that limit. We haven't necessarily completed Trinity requirements, which are another 10. So I think what I don't want to discourage you if you love biology or biophysics, and global health is a nice way to complement that. And, you feel really passionate about those things. That can be a great combination, and plenty of students will do that. But it's a really hard path. And if you assume that this is going to give you optimal preparation, and if you assume it's going to be impressive to a medical school, those aren't safe assumptions. So with majors, pick something you really care about. So this can be, for many of you, it's going to be biology or something biologically related, like evolutionary anthropology or neuroscience, or even other natural sciences like physics and chemistry. Partly because there's a lot of overlap between what you need to do for pre-health and those majors, and it just makes sense because that's where your interests lie. Other students are much happier majoring in a social science like psychology or sociology or cultural anthropology, or even an arts humanities major, because that's where they thrive. Those students who aren't majoring in natural sciences are going to find a lot of great balance in their schedules, since so many of the pre-med and pre-health classes are in the natural sciences. They're also going to be highly valued. Philosophy majors, they become really great with ethical questions once they get to health. There are so many things related to the social determinants of health that a major in sociology and understanding how social systems are constructed to really imperil people's healths and make their access challenging. All of these things can be really valuable. Computer science and economics majors, they bring a quantitative sense. So, rather than telling you that there's a major that we or medical schools advise, I can say that schools will accept any majors. And what they're really looking for is, do you make that course of study make sense? Do you do research in that area? Do you build strong relationships with faculty who, oh, by the way, are going to need to write you letters of recommendation and can offer you advice? These are the kinds of things they're looking for. So there's no one path that you all need to complete. So one of the things I want you to do as you're picking your first 4 classes, make sure there's a course or 2 in there that lets you explore major possibilities or fields that you just haven't had a chance to take in high school, because many of these will also be very relevant to your pathway within health, or broaden your exposure and help you become a really well prepared and well-educated person.
Great. We're going to head back to some questions about research. So do you have any advice on how to get involved in research and internships at Duke? And also another question, when do you recommend that we start applying for research?
Yeah, so these are great questions, and they're really going to be variable by individual. So I'm happy to put up the QR code, get on our listserv, because many folks will advertise research opportunities through that, and that can be a great way to get started. We will also throw out or push out things like Muser, Vast Connections opportunities. Those offices usually do a really good job of keeping us looped in when applications open. We also have an undergraduate research support office that in the fall will sponsor presentations on getting started in research. They will also host a biology professor who really likes to mentor students about what does it mean to get started in research and how to do it. If I had to guess, I would say the majority of our students get research opportunities through cold calls, and no one likes to hear that. So this is where I like to say, get on that undergraduate research support office and find the section on getting started. It's less about your experience and more about, do you understand what this lab does, or the general idea? So read the high level overview of, my lab is interested in Alzheimer's disease and these characteristic markers, and we want to understand more. If you're interested in Alzheimer's disease, communicating that in a very brief message to somebody is really helpful. I know by the time you get here for orientation, you will have peers that are starting research, and that will happen. I will say, though, that most of our pre-health students probably do not begin research until sometime in their sophomore year. Some even wait till junior or senior year to get started. So there's no one normal path. And this is a great opportunity for me just to sort of slip in. There are times as a pre-health students where you got to put on the blinders. Use your peers to get ideas and get advice, but don't let them stress you out because you compare yourself to them and you're not doing the same thing. When I used to teach introductory biology, I would watch students just almost be cruel to each other because they would talk about what they were doing, and one individual would hear from 3 or 4 peers about what they were doing and walk away with this sense of, I got to be doing what 4 people are doing. You need to do the work of one person. You're going to have your own path. And, peers can be great sources of advice. I will never turn down peer advising because they will convince students things that those of us that do this professionally cannot. But your peers can also really stress you out and make you feel inadequate. And when you're coming to a place like Duke, you're going to have amazing peers, but don't lose sight of the fact that you're amazing and you belong here. And there are lots of people that can help you figure it out. The other thing I want to plug around research is the Academic Advising Center has specialist advisors called directors of undergraduate or directors of academic engagement, or DAEs. And there is one for each of the divisions in Trinity College: natural and quantitative sciences, social sciences, arts and humanities. These are great people to sit down and talk about research in those divisions. There's also a global civic DAE who's got a really great finger on the pulse of more local opportunities like Basque Connections teams, but also global opportunities. So there are great ways to sort of integrate any requirement you've got to meet, whether it's pre-health or major or Trinity requirements. There's opportunities to do research in those areas, and these other folks can kind of help you figure out the best pathway for you and when to do it.
Great. Let's see. There's a couple questions about how to reach out to pre-health advisors. One is kind of saying that they were unsure about some math classes, so they went to the math department, but the math department said they should talk to their pre-health advisor. And then there was another question, I think it was maybe answered in the Q&A, but just how do students get in touch with for specific questions?
Yeah, so we're going to refer you to our advising handouts. And so I see that, the question related to pre-health and math is 111, which is calculus 1 versus 218. And this is where I'm going to say, you've got to do that fine-grained work of looking at the requirements of medical schools that you're likely to apply. If they say calculus, then 218 is not likely to do it, but you might reach out to that admissions committee and say, hey, I'm taking 218 because I'm assuming you're majoring in computer science, or whatever the reason is you're taking 218. I see you have a calculus requirement. How firm is that? I'm likely to go down a different path and not need calculus. Would you accept this other math class? And just give them as much information as you can, title and description, and see what they have to say. It's possible that you are going to need to take calculus and 218, but that's really going to come down to individual schools. So I promise you, be available during drop ad once you get to campus. And so we will help you resolve these kinds of questions if you still need to know once you get here. But so many of the things that come out of our mouths are going to start with, it depends, and you got to go look up the school requirements. There are over 150 medical schools, and they change things year to year, and they have all the power. Less than half the people that apply to medical school get accepted, and they can set these requirements, and they can do it pretty on their, at an individual basis. And so that's really what's going to determine whether this will meet your pre-health requirements or not.
Great. Let's see. Is it fine if we wait until sophomore year to do biostats?
Absolutely. In fact, I would encourage you to wait, because if you take biostats now and wind up as a psych major, you will have taken the wrong stats class. So that's part of why I would recommend to waiting.
Great. Does Duke offer EMT courses?
Yeah, so we have a Duke EMS campus organization, and they tend to bring a Durham Tech class to campus. I will say that their whole structure has changed considerably in recent years, and so I'm not positive that they will do that. Part of it is they are no longer allowed to take calls in Durham County, and so they have a much more reduced responsibility. They mostly work kind of backup to backups at the athletic events and offer classes like CPR and things like that. Even back when they ran call in the county, a former dean of admissions at Duke Med was never all that impressed by what students got out of being EMTs. And I would guess that she'd be even less impressed now, just because of the limit of the scope. I tend to try to encourage students to do things that don't cost you time and money. In terms of training, there are a lot of things you can do on the job training. Working as an emergency department technician or a scribe are things you can do without spending the extra time and money. One of the problems with getting EMT trained is that a lot of students then don't find ways to utilize it, and so it's a lot of time and energy put into something that didn't go anywhere.
You mentioned earlier that there was a large percentage of students that a large percentage of pre-health students that took a gap year. Can you talk about maybe why, or any insights as to why so many students take that gap year?
Yeah, so I think probably the biggest reason I like to promote is medical school and other admissions folks choose people with gap years over folks that don't have them. They're simply more competitive. If you consider what you were able to accomplish in 4 years at Duke versus 3 years, you will have done that graduation with distinction project, and faculty can talk about it and you can talk about it in your applications. But I think the biggest driver probably goes back to in 2015, they changed the MCAT and they added 4 more courses worth of content. So students used to be able to postpone these courses until after they had applied and could still take the MCAT. But when they changed it, it just became increasingly more difficult to be ready to do that MCAT junior year. The wonderful thing I saw with that, though, is that students weren't agonizing about, do I study abroad or do I avoid a gap year? And they didn't have to make these really hard decisions to do something really interesting and engaging and highly helpful for career preparation versus do what they felt was the norm. As soon as we hit the point where 51% of Duke students were taking a gap year, it was like downhill sledding. We went to 75 the next year and have kind of topped out at 81. And that 51% happened before the new MCAT. So I really think students and parents seeing no gap year as the normal thing was holding a lot of people back once it became the not normal thing. So students take gap years for all kinds of reasons. Most folks assume that you do it because there's something defective with your application. And sometimes that will happen where a student needs to boost their GPA or needs more time to study for the MCAT. But more often than not, our best students are taking gap years. And I think back when they used to publish median ages at the top 25 medical school, the median ages were showing that more than half their students were taking 2 gap years. So that goes back to the competitiveness thing. If you want to compete at the highest levels, having more experience and being ready to go can be really beneficial. So since this has happened, we host a panel every fall about former students who have taken gap years and are now in health profession school, so you get some idea of what to do, because that's usually the next point of conversation I have with students, like, what do I do at a gap year? And there's so many wonderful things you can do. The other thing I've noticed on those panels over the years is students who take a gap year, they treat med school classes like in a 9-to-5 job. They do what they can in those 8 hours, and then they go have a life. They're not stressing. at all hours of the day, because they know that they can't learn it all. They have to be strategic and they have to learn enough to pass. And they watch their straight out of undergrad peers just really kind of feel frenzied and frazzled because they're still in that school mode and don't have that life experience perspective.
Thank you. All right, I'm keeping an eye on the time. These are such great questions. Thank you so much for everyone that's been asking. Trying to get through all of them before our time is up. So moving on, does Duke require taking Chemistry 101 DL before Bio 201L?
Absolutely. I'm pretty sure in your first semester, this is hardwired where you cannot take it. As a molecular biologist, I do not recommend taking Bio 201 without a strong chemistry background. I like to recommend that students have some orgo exposure before they take Bio 201 because the textbook they use assumes that you've had organic chemistry.
Okay. This one is back to Calc 1. Is Calc 1 the class that most pre-health students use for medical school requirements?
I would say it or AP credit is, so that could be either Math 111 or the combination of 105, 106. And part of that is you're going to need some calculus to do physics at Duke. We don't offer physics without calculus. So aside from what schools want, you will need some calculus if you take physics here.
Okay. Does developmental psychology count towards the psych credit needed for med school applications?
Think so. In fact, there's some careers like nursing that prefer developmental psych over other types of psychology. But again, that's one where it really helps to go look. So for example, to pull out UNC Chapel Hill again, they went 3 social sciences. One of those can be psychology, and I don't think they specify which one. Sometimes students will also enroll in a neuroscience 101 course as Psych 106 or 107. They're the same thing, but now they have a psych on their transcript to please a school. The one thing I will say, and I'm assuming you're taking developmental psychology because you have a strong psychology background. If you do not, I recommend Psych 101 because the MCAT tests that content so explicitly. There's a social and behavioral sciences section of the MCAT. It's 60% Psych 101 content, 30% sociology, and 10% neuroscience. So you get the biggest bang for your buck with Psychology 101. With sociology, I do not recommend 110. I say go take an interesting medical sociology class. So I diverge on that recommendation there.
Okay. How attractive is studying abroad to medical schools?
Yeah, so one of the pre-medical competencies is cultural competence. So study abroad is often a way to develop language skills that you will never get from sitting in a classroom. Also, if you don't study abroad with a bunch of your friends from America and hang out with Americans, but really get out in the community, you have the opportunity to take advantage of that place and that setting. Some students will also go volunteer or shadow and understand the health system to get a comparison view there. So it's certainly, while it's not a absolutely must-have kind of experience, it certainly is one of those that sort of quintessential American undergraduate experience and can be very valuable depending on what you bring out of it.
All right, we've got some last minute questions here. In general, what happens to the 24% that do not get into medical school in the first trial?
So it might be 24% at Duke, but nationally, I think one of the latest things, only 39% of people got accepted. But many schools will give you feedback on your application. Was it your interview that bombed you? Were you not prepared? Were your metrics low? They're willing to kind of give you some guidance. Our office can also look and say, oh my gosh, look at your list of schools. It was not a good fit for, who you're bringing. Boy, you answered these questions with bullet points and there were no reflection, or you looked like generic pre-med. So we work with a lot of reapplicants and we're happy to help them figure out what went wrong. We're really proud of our Review My Application process and all the support we offer to students going in, that we really try to head off that process. So definitely stay connected with our office and utilize those resources so that that's not you, that you get in the first time.
Absolutely. Do you recommend students taking Bio 201L and 202L in the same school year?
I don't think that is so important. The only pair of classes that I really try to get students to connect to each other are Organic 1 and Organic 2, because I think losing that information over a long gap can be detrimental to being successful in the second one.
Seminars are required first year. Are there any that you would recommend for pre-health?
There are some that have a health focus, but I encourage my advisees, if you're science oriented, look at those for getting your arts, literature, and performance or civilizations. They can be opportunities for you to explore a major if you're not able to fit that in elsewhere. So I like the What Now seminars and focus, because they bring something else to that seminar class for you. So I guess I would not say there's anything specific, but build balance. Don't do 4 science classes in any semester unless you're deep in your major and that's what it comes to.
Great. Okay, I'm gonna have to pick and choose questions now. Can you briefly mention the sociology class that you recommended?
It's not
again?
one class, but if you
Oh.
go on the sociology department website, they have a minor in medical sociology. Any of the courses that will earn you credit toward the minor in medical sociology is a winner. And many of them are service learning. What students tell me, and I don't hear about this about any other the pre-health classes, they find a class really interesting and exciting and they want to do the reading even if it's late at night. So they're really wonderful. They will remind you why you want to go into what you're going into in a way that organic and physics and my beloved molecular biology just will not.
Great. Okay, and for our last question, I'm keeping an eye on the time, is do you have any comments on engage, immerse, focus, ...
They're all really high impact things that put you in close contact with faculty. So it makes it easier for you to get advice and mentoring and a deep experience in things. If I just want to be instrumental, getting letters of recommendation is easier for students who do those things. They all have upfront and obvious costs, but the benefits will feel really abstract now, but they're incredibly powerful. So I would definitely encourage you to talk to folks like the directors of academic engagement for more information. They probably have worked really closely with students who've done those things and can give you advice.
Great. All right, I'm gonna stop sharing here. Okay. So that concludes our webinar, summer transition series. I do have some extra slides about upcoming ones. We're taking a break for first year students, and our next webinars will be in August. Refer to your blue book. They're all in there. Register, have some great conversations. Thank you so much, Dr. Pers, for all of your knowledge. And thank you for allowing me to be part of it. I'm definitely not involved in the pre-health majors. Your questions were so insightful. We're so excited to have you as part of our community. And welcome to Duke. All right, thank you.
Bye, everybody.